Good afternoon. This is Dr. Havens. This is our recorded lecture for the third of 3 chapters that we're going to be discussing for Unit 4, 10, 11, and 12. This is Chapter 12, and we will be discussing maintaining a safe work environment. So our goals for Chapter 12 are to recognize threats to employee safety in the healthcare work environment, and to recognize several agencies that are responsible for overseeing workplace safety. We are also going to discuss several methods for dealing with threats to employee safety in our workplace, and we will discuss the role of the nurse in dealing with threats to employee and workplace safety. All staff members have the right to be made aware of potential risks in the healthcare workplace and to be provided with as much protection as possible. No healthcare worker should ever be made to feel unsafe or uncomfortable in their workplace. It may surprise you to learn that healthcare facilities can be some of the most dangerous work environments in the U.S. Some of the threats to our safety as nurses include sharps or needlesticks injury, exposure to various hazardous chemicals, as well as radiation, ergonomic injuries that have to do with movement, lifting and repositioning of our patients, exposure to infectious diseases, and physical violence from aggressive patients. 2 of the agencies that are responsible for providing for our safety in the workplace are NIOSH, NIOSH, the National Institute of Occupational Health and Safety, and also OSHA, Occupational and Safety and Health Administration. Both of these government agencies were created by the Occupational Safety and Healthcare Act of Federal Law of 1970, so they've been around about 40 years. Excuse me, they didn't do the math. Actually, these agencies have been around 50 years. Also, the National Safety Council partners with OSHA to provide employee safety training in most workplaces. Workplace safety is the responsibility of both the employer and the employee, whether it's in a healthcare setting or otherwise. There is training that we have to receive so that we can help ourselves stay safe and healthy on our jobs. Therefore, we are accountable for knowing and following safety standards and guidelines in the workplace, and our employers are required by federal law to ensure a safe and healthy work environment for us. The primary goal of OSHA is to prevent workplace illness and injuries, and also to save the lives of employees across the U.S. Employers are required by federal law to comply with OSHA regulations to provide a safe and healthful work environment. And they are also required to keep records of all job-related, or what we call occupational illnesses and accidents. Sometimes when you go into a workplace, you may see a sign on the wall that says it's been 1,153 work days since we've had an injury on this site. So usually, adhering to OSHA standards is a source of pride for employers. Workplace inspections can take place without any prior notification to the employer. OSHA inspectors can just come on to the job site or into the healthcare facility and inspect at any time, and employees can file a formal complaint online, and as a result of this, an inspection will be ordered. Any OSHA violations that are found must be posted where employees can see them. This doesn't mean that patients and their families or visitors can see them, so this will usually be posted in an employee break room or somewhere of that nature. Also, federal law requires that employers can't discriminate or punish employees for exercising their rights related to safety and health hazards or participating in OSHA inspections. There are several particular issues that OSHA focuses on when inspecting healthcare facilities. These have to do with the bloodborne pathogens and needle sticks, ergonomic and lifting guidelines for proper body alignment. This is especially to prevent nurses from getting back injuries. Confined space regulations such as isolation rooms, respiratory guidelines, and also there are guidelines about prevention of workplace violence. So what role does the CDC or the Centers for Disease Control and Prevention play in workplace safety? So they partner with the other agencies to do research, develop prevention strategies, and promote basically safe and healthy work environments. They publish continuous updates for recommendations on how to prevent infectious diseases like HIV, hepatitis, and so on and so forth. They also publish a weekly report called the Mortality and Morbidity Review. You can see this online. Back in the day when I first started working as a healthcare provider, you used to actually get a printed paper copy of this in your workplace every week. Now, of course, that's all online, but this can be something really interesting to read. It gives a lot of facts and figures about what kind of incidents have happened in healthcare facilities around the U.S. in recent weeks. The American Nurses Association, which is our nursing professional organization, or one of them, as we've said in previous weeks, also provides a lot of information for safety and advocacy for nursing. They have a commission on workplace advocacy that addresses not only collective bargaining and issues like that, but also anything from staffing ratios, mandatory overtime, workplace violence, conflict management, ethical issues, and things like latex allergies, needle stick safety, and ergonomics, and other topics that are related to our health. Similarly, the Joint Commission, or TJC, comes around to all accredited healthcare facilities, which is most of the hospitals in the U.S., and requires them to have an extensive on-site review, including workplace safety issues, once every 3 years. So this is on their radar as well. Similarly, there is an NGO, a non-government organization called the National Academy of Medicine, or the NAM. It's formerly known as the IOM, or the Institute of Medicine. This organization's mission is to improve people's health all over the globe. So they have their hands in a lot of issues, but they also have a quality initiative to keep tabs and continually assess the U.S. healthcare system. There was a very famous report in 2004 published by the IOM called Keeping Patients Safe. This has a lot to do with organizational culture, patient safety, and also workplace design to keep nurses safe. So let's talk for a couple of minutes about developing workplace safety programs. If you go to work for a hospital or another healthcare facility, you may be asked to serve on a committee or team to develop such a program or plan to protect nurses and other staff members from harm, and also to protect the organization from any liability that could result from such harm. The first step that your group or committee would do is to recognize what are the potential hazards, and we pretty much know what they are. Blood-borne pathogens in healthcare is always a big hazard, needle stick injuries, and so on and so forth. Ergonomic injuries are huge, especially nurses getting back injuries. There's a lot of heavy patient lifting and that kind of stuff. Is there sufficient PPE to keep nurses and other first-line healthcare staff from exposure to COVID, and so on and so forth? So after you have recognized the potential hazards, the second step that your committee would do would be to list a thorough assessment of the amount of risk that this is entailed. So you would want to assess how many nurses annually in this facility experience back injuries from patient lifting, how many needle sticks are there in this facility every year, how many nurses and doctors and other personnel have tested positive for COVID after exposure to COVID patients in the units, and so on and so forth. How many work days have been lost due to back injuries? How many nurses have had to receive workers' compensation? How many nurses have had to take early retirement? This is what we're looking for here. Then in the third step, your group will create a plan for optimal protection for all the healthcare staff members. So what kind of new and different or additional PPE do we need to provide our workers so that there are no new cases or minimal new cases of exposure to COVID from caring for these patients? What type of training or classes do we need to offer in body mechanics and ergonomics and safe lifting, or what type of equipment do we need to purchase, like Hoyer lifts, etc., to protect our employees from back injuries, and so on and so forth. So you create your plan. And then the final step would be to implement the plan. So let's talk for just a minute about preventing violent behavior in the healthcare workplace. Preventing an incident is a lot better than having to intervene after a violent incident has occurred. What are some things that we can do to prevent violence in the workplace? Well, we need to regularly participate in assessments of what are the risks in our particular workplace. Some of them might be verbal expressions on the part of a patient or a family member of anger and frustration, not getting their needs met, maybe threatening body language, such as yelling, clenching their fists, an angry look on their face, that kind of thing. Being alert for any signs of drug or alcohol abuse that can lower inhibitions and cause people to behave in ways that they normally would not when they're sober, or the presence of a weapon or anything that can be used as a weapon in the workplace. It's also important to know our patients. We should be aware if they have a history of alcohol or drug intoxication, if they have any kind of psychiatric diagnosis or neurological that would suggest that they have a potential for violent behavior, and also any documented history of violent behaviors either in the recent or remote past. So we should also maintain behavior at all times when we're on our jobs as registered nurses that will help to prevent or diffuse anger or aggression or agitation. Always present a calm and caring attitude. Don't swap or match threats with a patient. Don't up the ante, give orders, or display behaviors that can be interpreted as aggressive to the patient, because this may trigger a behavior that you don't want. And always acknowledge how the person is feeling whenever a patient is upset or displeased or frustrated with their situation. If you can't diffuse that situation, then remove yourself from the patient room or from the situation, the group room, or wherever this is occurring. Call hospital security and report the situation to a manager. If an incident of violence occurs that involves you or either in your presence, which is something you witness, report it to your supervisor. Write a report that includes a thorough description of the situation, what happened, any witnesses, all the victims, as well as the perpetrator, and any other pertinent information like time, date, place, and what led up to it. Make sure that you call security. Nurses are entitled to the same type of protection from law enforcement that everyone else has who's been assaulted. Make sure that you get medical attention, including counseling, medical care, or anything that you need. If the situation can't be resolved within the workplace or at the local level, you may want to contact your state nurses association, which for us is the FNA or the Florida Nurses Association, or contact OSHA if the problems exist. And be proactive. If this is a problem in your workplace, this is an ideal opportunity for you to get involved in policy making concerning workplace protection for nurses. It may surprise you to know how many needlestick injuries happen every year in U.S. hospitals and healthcare facilities. It's somewhere between 600,000 and 1 million. This may actually be shocking to you. So why is this a concern? As we know, needlestick injuries are a route for HIV infection, as well as other bloodborne pathogens such as hepatitis B and C. There have been a couple of important federal laws that have been passed to help protect us from sharps injuries, such as the Needlestick Safety and Prevention Act, and the OSHA Bloodborne Pathogens Standard. All healthcare facilities are required to have a written plan to prevent sharps injuries, and it gets updated annually. This should be available for you to read with your annual training, and also posted somewhere on the intranet or the hospital website. And all staff should receive annual training during their work hours every year and have a right to be involved in the selection of the type of safety devices that the hospital chooses to purchase. So what are the employees' responsibility in preventing needle sticks and other sharps injuries? Well, we have to make sure that we keep our annual training up to date. We have to report all exposures according to the facility's protocol. We need to stay up to date with our hepatitis B immunization series, make sure that we use and dispose of all sharps properly, and always use universal precautions. There is a number that you should call if you have any questions about treatment for a needle stick or don't feel like it's being handled properly. 1-888-448-4911, which is the National Clinicians Post-Exposure Prophylaxis or PEP line. Let's talk for a couple of minutes about latex allergy and its importance in the healthcare workplace. The two most important forms of latex exposure in terms of allergic reactions are either the skin or through inhalation. And reactions can range from either a mild rash all the way up to anaphylaxis and life-threatening breathing problems. A latex allergy should be suspected for any healthcare worker who develops such symptoms after exposure to latex. A complete medical history and blood tests can detect a latex allergy and verify it. There are also skin testing and other glove use tests available for confirmation. Complete latex avoidance is the most effective approach to keep a healthcare worker safe. This is actually fairly common. So employees that have a latex allergy should consider wearing a medical alert bracelet. It's that important. And in many healthcare facilities, they use alternative gloves like the vinyl gloves or nitrile because you can avoid the possibility of a latex allergy reaction that way. People that have allergies to certain foods and other like grasses and pollens may be at greater risk for latex allergy. So I have a friend, a registered nurse, who had reported to her employer, and it was well documented, that she had a latex allergy. The healthcare facility was really good about providing her with vinyl or nitrile gloves. However, one day she reported to work and the nursing unit was being painted. It was on a weekend. So it was a Saturday morning. She showed up for her shift. She began to smell the paint fumes and she didn't feel very well. She asked the workers and confirmed that they were painting with latex paint. So she was short of breath and she was inhaling the latex. She called the nursing supervisor and asked permission to go home. And the supervisor said, well, it's the weekend. I literally don't have anyone that I can call in to replace you. Everybody feels a little lightheaded when they have to breathe paint fumes, but you're just going to have to stay at work and stick it out. So she did that. It was a 12-hour shift, after which time she was seriously ill. She presented to an emergency department of another hospital after her shift. Long story short, she was hospitalized, and it got documented that she had some outcomes that weren't so great to her health from serious exposure to the latex, and she's now medically retired, and she received a settlement from the hospital. Back injuries are a very common occupational related incident that happens to nurses. Our book states that more than 75% of nurses will experience a back injury at some time during their nursing career. OSHA has some publications about safe patient handling that you can find on their website. It's considered to be our responsibility at nurses, as nurses, to learn how to do safe lifting And our employer's responsibility is also to provide training and education about safe lifting and good body mechanics, and also to provide assistive equipment for us during patient transfers. Even when we use proper body mechanics and we're physically fit, any unexpected movement or resistance from a patient can throw a nurse off balance and result in a back injury that can be serious. So this is a not uncommon problem. The next topic we want to talk about is staffing ratios and its effect on patients' outcome. We know from many years of research that low staffing of nurses can increase inpatient mortality. It can result in more UTIs, more bed sores, more cases of pneumonia, and so on and so forth. The effects on nurses themselves with low staffing ratios can actually increase the probability of a needle stick or other injury in the workplace, and also eventual nursing burnout. So our professional association, the ANA, American Nurses Association, recommends changing the way that we make staffing decisions from the industrial model to looking at the factors that are needed in the professional model to provide quality care to patients. The professional model of staffing includes factors such as patient acuities or level of illness or complexity, the number of admissions and discharges on a unit over the course of a particular shift, the number of professional and ancillary staff available, the layout and the size of the unit, and also other available tech support and other resources. The ANA Code for Nurses has language about our responsibility as professional nurses to report questionable behavior in the workplace that could adversely affect the welfare of any patient. Most employers have policies that encourage reporting this behavior too. What type of behavior are we referring to? We're talking about anyone who is seen abusing their authority, grossly wasting resources, willfully violating rules and regulations, or any standard of professional ethics, or any behavior that might endanger a patient's health or safety. We are expected and required to report. As nurses, we need to be willing to identify and report problems in order to ensure patient safety. The term whistleblower is used for any employee who reports employer violations of ethics and patient safety rules to an outside agency, usually to a government agency. So you can't assume that because you're doing the right thing that you'll be protected. Speaking up can actually get you terminated or removed from that position unless you are specifically protected by a union contract. However, your state professional association may be able to provide legal representation to get your job back. Some states have whistleblower laws, but often they only apply to certain types of employees or workers. And it's always important to work through the employer's chain of command and internal procedures before filing a whistleblower complaint. Thank you.